When someone first looks at this case or hears about this case or views this case, you might think that this family needs, some caregiver support, some medical help, there's mental health issues. But as you get closer and as you, find out more about the situation, you may learn, for example, that maybe there's a child living in the home. Maybe, in fact, that they've run through all of their resources and they're about to be evicted. Maybe, in fact, there is a need for an order of protection. Maybe there is some violence going on. And so the more that you learn about a situation, you can begin to see how complex these situations really are. And it really may involve, the healthcare systems, mental health, civil legal services, criminal justice, law enforcement, adult protective services, child protective services, victim services. It could really just expand. Right. And so, so then there you are. You've gone from maybe thinking this is kind of, something that could be resolved just by you giving a consult to a doctor to, oh my, we have all of these systems.
If a case comes to the team, there's many systems that are involved who sit around the table. Adult Protective Services, Department for the Aging, elder abuse service providers, there's geriatricians, we have geropsychiatrists, we have people who focus on legal issues. We have civil legal individuals who are represented. We have the DA's office also if there's a criminal element. All of these people, and we have shelter systems who can also sit in and help weigh in if that is an option for a victim. So we're a pool of resources that sit together to develop an action plan to really help somebody and move things along.
What's so important is that when you're working on your own, if you're a doctor or if you're a nurse or a social worker or an attorney, you don't necessarily, your organization or you as an individual, just don't have those resources. So it's unlikely that in a social work, social service agency that there's going to be a geriatrician or a geropsychiatrist or a forensic accountant around to help you discuss that element of a case. So to be able to bring those resources to a community is so important.
And also having all these professionals working together, closer relationships, building better rapport, so it's easier to call somebody about a case, run things by them. You're really networking and working together.
In terms of complexity, in this case, clearly there was, it seemed like there was neglect. Mm-hmm. We don't know about other types of abuse. There could have been some physical abuse. Psychological abuse clearly was going on. There might be some financial exploitation. So when you think about complexity, it's also that there are these co-occurring types of abuses, and in order to resolve the entire picture and to reduce the suffering and increase the safety, we need to address all of that.
So anybody who's really had contact with this victim and worked with them in some capacity will be invited to the MDT, will sit, give their perspective on the case. And then the person who is referring the case will develop some questions for our team. What do they need help with? What are the things that they're struggling with? And even as a team, we may come up with other things and say, well, you haven't quite thought about this. What about this element? What about this aspect? We'll also look at ethical issues in the case as well. And try to resolve those. So again, getting everybody around the table, making sure that we're all coordinating our services. Some of these cases you'll find people duplicating services or people just falling through the cracks, which is often the case. And we really want to make sure that we use these scarce resources really effectively. So after a case is presented at the MDT, there is a date given for a follow-up. It's usually anywhere from 2 to 4 weeks after the initial meeting. And prior to the end of the meeting, I'll list tasks for people to follow up on. Some cases are reviewed many, many times for many follow-ups, so it could go on for several months depending on the complexities of the case and where we're at. Other cases may only need to be reviewed once or twice. It really just depends on the need of the case. People feel vulnerable when they're bringing cases to the MDT. They're laying all of their work on the table for everybody to judge or view, and it's a scary process. Yeah. So really helping them prepare, outlining what they've done, who they've worked with on cases, what are their questions, what are they struggling with, what does this victim really need, what do they need help with, because their agency may or may not do those specific tasks. So the New York City Elder Abuse Center also provides a lot of training to community agencies, and that's to help them really detect the problems, look for red flags, identify types of abuse, and discuss what resources are out there in the community for them, one of them being the New York City Elder Abuse Center multidisciplinary teams.